And welcome back. Well, some local cancer patients celebrating the gift of life. They had a little hope for recovery, but a clinical trial is now giving them a second chance at life. TV 1055's Alice Gaynor explains.
Flowers were passed out to patients who've done a complete turnaround, like this woman, now smiling ear to ear. The tumor in her abdomen almost non-existent.
The disease is basically gone. The tumor is 90% reduced.
I shouldn't have been here.
And this great-grandmother.
According to the doctors at the beginning, they said it wasn't going to be possible that I would live more than 6 months.
And how long ago was that?
It's almost 3 years.
All of these metastatic cancer patients faced a grim prognosis, but now
we can actually give patients back their full longevity with these drugs, or it so appears.
The patients in this room at Winthrop University Hospital participated in a clinical trial. They were treated with Opdivo. It's the first drug approved by the FDA for lung cancer and works by enabling the body's own immune system to fight the cancer. But many of these patients have other cancers like melanoma. Of the 70 patients they've treated in this clinical trial, about 12 have had these positive responses.
That I feel good. I feel good. I mean, I feel normal. I don't feel no pain. I don't feel dizzy.
Pain-free.
Pain-free, no hair loss, no nausea, nothing.
Patients say the treatment is every 2 weeks for about 40 minutes, and doctors say some have been resurrected.
My daughter was 5, and I didn't think that I would see her graduate from high school. And this year, that's what she'll be doing.
And the clinical trials continue to try to help the 80% of patients who have not improved with this. Joining us now is the head of this Opdivo clinical trial program at Winthrop University Hospital. He is Dr. Jeffrey Schneider, and welcome to the show, Doctor.
Thanks so much.
You know, what is Opdivo and how does it work?
So, first of all, I'm really glad that you showed that segment, because this is really all about giving a new opportunity and hope to patients that for so long have not had really any perspective that they were going to get back any of their longevity. That's the difference maker with these drugs. These drugs don't buy a little bit of time. When they work, they actually give patients back their full longevity.
So now how does it work? I mean, is it an injection? How do they receive it? Does it go along with other traditional forms of a cancer treatment like chemotherapy, radiation surgery, or is it totally apart from that?
Sure. Well, the way in which it's administered is actually somewhat analogous to chemotherapy. It's a liquid that is injected through an infusion into a patient's vein. And that's probably the only similarity to chemotherapy. Where it starts to break away from chemotherapy is there is essentially zero what I call in-chair toxicity. In other words, when you give somebody chemotherapy, they can immediately get nauseous. They could immediately have a hypersensitivity reaction. So many things can happen to them in the infusion center itself that they begin to become hypersensitive just to walking into the infusion center. These drugs, when they're given, do nothing immediately. What they do down the road is they entice the immune system to recognize the cancer. So we're actually not giving a drug that would do anything in a test tube to a cancer. These drugs would be a dud in a test tube because the immune system's not there.
So you get in your own body to do the work like you would want it to do.
Exactly.
What are the side effects, if any?
So what these drugs do is they teach the immune system to bypass the checkpoints that prevent the immune system from attacking our cells. That's really the way they work. And
because normally you'd want them to attack the cancer cells, but that's been part of the problem. But you've identified that process, and you're trying to, what is that, like tricking the immune system?
So exactly. So you know, we've known for a very long time that the immune system is extremely important, both in the generation of cancer. Immune deficient patients get cancer at a much higher frequency than patients that don't have those immune deficiencies, and that restoration of immune deficiency is an answer to that problem. What we haven't known and what's come out with these drugs, and Opdivo is the first approved in this space, but there is a litany of drugs coming up behind. This is just the very, very tip of the iceberg.
Well, this has been amazing how much progress we've seen with all cancers in the last decade. It used to be considered hopeless. They used to call it the big C. People wouldn't even say the word. Sure. They were so afraid of it. But now, what about the 80% of the people that are not responding? Does that make these results somehow questionable? Or why is it that they don't see the same results that the successful people and the patients you profiled there?
So what we've recognized is that that with this particular drug, Opdivo, we're blocking one of the signals that the body has to decoy the immune system from attacking it. It would be sort of analogous to, you know, if you think of the immune system, if you will, as sort of an army, and you think of the cancer as the enemy. Well, the checkpoint is like the American flag, and it's like the tumor is holding up an American flag to our own army, saying, hey, don't attack us, we're part of you guys. And what these drugs do is they throw a blanket on top of that American flag. They block the checkpoint that the tumor has co-opted from our normal defense against immune attack.
Talking about the trick in the immune system there. But again, you know, maybe I didn't hear you say that, but are there any side effects to this?
So that's a great segue. So the side effects are what you would actually expect. The side effects are that we have a carryover to potentially attacking our own normal tissue, because this is a normal mechanism of defense against the immune system for our normal tissues. So what we call autoimmune disease is the major problem. Now, fortunately,
that can be the side effect from this because of what you're doing to the immune system.
Exactly.
Well, let me ask you this then. You know, this is a big deal because, you know, pharmaceutical companies say, hey, we spend billions to develop these things and we have a right to make a profit. There was a big controversy with one CEO getting in trouble, jacking up the price of an important drug that was used for HIV/AIDS. What's the situation with this drug? Is it affordable? Are people going to be able to pay for it with insurance, or is that going to be an obstacle for seeing it expanded to further treatment?
So I do think it's a challenge.
Well, what does it cost?
The drug is about $18,000 a month.
Wow.
And patients, you know, we've had patients on the drug now in excess of 3 years, so it's sort of the price of success. You know, when you have an expensive drug, but it doesn't work very well, it doesn't, you know, you don't run up the numbers.
So I'm sure you want to see that get expanded with more people using it, and then of course that lowers the cost. They can spread it around. The insurance companies maybe bring that down because, you know, the insurance companies got to meet their bottom line too. So here's the question though: how does somebody who's heard this get involved? How do they become a patient, and who's eligible? You have about 20 seconds to answer that.
Well, first off, the good news is that the studies that have been done and that many of those patients participated on have made these drugs FDA approved. So their standard of care for lung cancer, their standard of care for kidney cancer, and their standard of care for melanoma. They're going to work in other diseases. We are doing clinical trials, and the best way to get access to them is to, you know, work through your doctor, your oncologist, and ask to be referred.
So ask for a referral.
And certainly we have a big program at Winthrop.
Well, there's promise with it, and we'll take anything when it comes to treating cancer that is going to be a positive. Dr. Jeffrey Schneider, overseeing the lung cancer project at Winthrop University Hospital. Thank you for explaining this new treatment, Opdivo, and we'll be right back.